Good afternoon, everyone. My name is Mike Stearns. I'm the Director of Pharmacy at Ellenville Regional Hospital in Ellenville, New York. And this is another in our series of Facebook Live. And I want to thank the Rural Health Network for affording us this opportunity to be able to reach out to people. We've been asked today to talk about anti-diabetic agents and diabetes. Diabetes is a very prevalent disease in our society today. It's the #1 cause of blindness. It's certainly very involved in the cause of chronic kidney disease and very serious disease that perhaps people could learn to take a little more seriously and learn a little bit more about the medications. We certainly have advanced from where we were when I first came into pharmacy, and we have a lot more medications in our armamentarium now to be able to treat diabetes. And so we're dividing this up over the course of many weeks because there's many medications involved in the treatment of diabetes. Now today I'm fortunate to have 3 students with me who have been here a varying number of weeks now, and they come from 3 different colleges of pharmacy, and so I'd just like to quickly introduce and then we'll come back. But we have Victoria Fenton from Albany College of Pharmacy, Yad Anwar from Long Island University, and Natalie Lugo from St.
John Fisher
College, Wegmans College of Pharmacy in Rochester. But Natalie's homegrown. I've known Natalie for a little over 7 years now, and she first came through the hospital here as part of a program in high school and decided that she liked pharmacy. So we welcome her back to the community as well. So diabetes, there's at least 4 different types of diabetes, if not more, and there are more and more distinctions between different types of diabetes. And most people are probably familiar with the juvenile onset type of diabetes and also with the adult onset or type 2 diabetes. So most of what we're going to talk about is primarily focused on type 2 diabetes today. Some of these medications will not work at all in type 1 diabetes because of the nature of the type 1, but they do work fairly well to varying degrees with type 2 diabetes. So what is diabetes? Well, we can diagnose diabetes. It's too much sugar in the blood, too much blood sugar primarily, and this can have a lot of different effects on a lot of different organ systems in the body, resulting in, like mentioned before, blindness, and kidney disease, cardiac involvement, just a lot of different things that can be very negative for the human organism. And so we kind of monitor diabetes by looking at the fasting blood sugars, looking at 2-hour postprandial or 2 hours after you eat blood sugar levels, and also more longitudinal and probably a better measure in the long run is the hemoglobin A1C, which gives us an idea of glycemic or sugar control over a period of about 90 days. So these are tools that we use in monitoring diabetes, which is a far cry from where it used to be when I first came into pharmacy. The only way we could really measure diabetes and dose insulin back then was based on the amount of sugar spilling into the urine, which wasn't the greatest measure, and certainly we don't use it that often today. So there's a lot of different ways to look at this. One of the hallmarks of type 2 diabetes is insulin resistance, and so we can end up with a lot of insulin in our bloodstream, but it's not as effective as it could be. And some of the medications that we'll talk about today modify how the insulin resistance is affected. And one of the other pieces to diabetes is problems with cholesterol and with triglycerides. Our bodies are always either building up or breaking down sugar to maintain a certain amount of glucose in the bloodstream or blood sugar for our brains to function well. So we can either be building up or breaking down. Some of the storage forms of sugar that we have in our body would be triglycerides, and characteristically many people with especially type 2 diabetes have high levels of both cholesterol and triglycerides. So some of the medications we use also modify those values as well. So at this point, I think I would just like to move forward, and we're going to talk about one of the newer classes of medications that are used and have just come out within the last 10 years or so within this country for management of blood sugar, and that would be glucose reuptake inhibitors. And those really work at the level of the kidneys. And I'm going to ask Nihat to speak to those a bit.
Hello, everybody. Like Mike mentioned, excuse me. My name is Nihat, and I'm a pharmacy student at the Arnold and Marie Schwartz College of Pharmacy at LA Brooklyn. So again, I'll be discussing what's referred to as glucose reuptake inhibitors. So some of the common medications among this class are, some of them would be dapagliflozin, which is referred to as Farxiga, empagliflozin, which is referred to as Jardiance, often, and canagliflozin, often referred to as Invokana. So the basic function of this medication is to lower your blood sugar, primarily for type 2 diabetes. And unlike other medications, like Mike mentioned, of course, it works on your kidneys. So other medications, which my peers would discuss over here, would affect insulin sensitivity or increase actual insulin amount, but this works in the kidneys. And what it does, it prevents the glucose to be filtered out through the kidneys, and it prevents the glucose from being filtered back into the system from the kidneys, and it removes the glucose through the urine, so glucose being sugar. So as you can expect, as sugar is being removed, one of the most common side effects you can see is sugar in the urine. Normally that wouldn't be the case. Like there wouldn't be any sugar in the urine for the normal human system. But in this case, a common side effect would be that, again, you'll see sugar in your urine, and this is not something to be alarmed about because that's just how it works. Other side effects would include increased chance of UTI or urinary tract infections, and it can also lead to weight loss because as glucose leaves the body, leaves the urine, water will follow. So that will lead to some weight loss, will occasionally lead to dehydration, and a lot of times frequent urination, and overall a lowered blood pressure. Now, what would happen if you missed a dose of this medication? So this is something you wouldn't want to panic about. Take it as soon as you remember, but if it's closer to the second or the next dose, what you would do is just take that next dose and not try to make up that missed dose. You don't want to double up or add on any medications more than necessary. Now, while you're taking this medication, you will have to periodically check in with your doctor and check in for both your blood sugar levels as well as your A1C levels to see if there's improvement. And depending on how controlled or uncontrolled the diabetes or the blood sugar is, you may be recommended to stay on this medication for maintenance for extended periods of time, or depending on the doctor, you may be removed from it. So Jardiance in particular, Jardiance also known as empagliflozin, has been particularly known to decrease chances of amputation, which is a common complication in very high uncontrolled blood sugar. And of course there are different benefits to each of these different medications, and there are a lot of trials and studies being done on them as they are newer in medication class. So that being said, I'm going to shift it back over to Mike.
Okay, well, thank you.
Back to Mike.
One of the things that we always recommend when you have any questions about medications is to speak to your provider, speak to your pharmacist, give us a call. Here at the hospital as well, we have a program that we started probably 12 years ago now or so, where we meet with people and discuss their medications, when to take them, how to take them, what to do if they miss a dose, do they work together, can I take these with other medications, over-the-counter medications, and that's a free service that we provide here at Ellenville Hospital. So, give us a call. We'd be happy to talk to you or make an appointment. The number here is area code 845-647-6222, and the pharmacy extension is 229. If we're not there to pick up the call, we do have an answering machine, and we will get back to you as soon as we can. So thank you, Nihat, for your information there. And now we're going to speak with Victoria on another category called sulfonylureas. So, Victoria.
Hi everyone, my name is Victoria, and like Mike said, I go to Albany College of Pharmacy. So I'm going to talk to you about a group of medications called sulfonylureas. And the three main medications in this class, the first one is glimepiride, the brand name is Amaryl. The next medication is glyburide, the brand name is Diabeta. And then the last medication is glipizide, the brand name is Glucotrol. So all that sulfonylureas is just a fancy name to say these medications, when you take them, they're just little pills that you take. They cause your body to release more insulin, so that helps with your blood glucose control. So when you take this medication, it'll lower your blood sugar and it will decrease your A1C over time by 1 to 2%. So that's awesome. They're really, really effective. But like all medications, they do have some side effects. So the main side effects that we're concerned about is it could cause a little bit of weight gain, and then it could cause your blood sugar to go a little low. So when your blood sugar goes too low, that's called hypoglycemia. So that's the main thing that we want to talk about, because we know that high blood sugar is bad, but if your blood sugar gets too low, that can also be dangerous. But there are some symptoms and some signs that you can notice within yourself if you're taking this medication that could tell you that your blood sugar is too low. So if you feel anxious, shaky, nervous, could cause sweating, your heart rate feels a little bit high, I said shaking, any of those symptoms, confusion, that could indicate that maybe your blood sugar is too low. And so if that happens, the good thing is there's an easy solution. Your blood sugar is too low, have some sugar. So just drink some juice, or they sell little glucose tablets in the pharmacy that you can always keep in your purse or in your bag, so you always have them. And that way you can just have some sugar, raise up your blood sugar a little bit, and you'll be good. And then it's just important to talk to your pharmacist or your doctor about all the medications that you're on, because sometimes there are some medications that you might take that might hide these symptoms of low blood glucose. So for example, there's a class called beta blockers. So that's like metoprolol, propranolol. And if you take those, and if you take these medications, the sulfonylureas, you might not, and your blood sugar goes too low, you might not feel the symptoms. You might only have a little bit of sweating, but nothing else. So talk to your doctor and your pharmacist about everything that you're on, and just keep in mind if you're taking glimepiride, glipizide, or glyburide, just pay attention to low blood sugar. But like I said, they're great drugs, they've been around a long time, and they're really, really effective. So I'm going to turn it back over to Mike.
Okay, thank you, Victoria. And just to follow up a little bit, is that if you're taking beta blockers and even insulin. Now insulin, all the insulins we're going to talk about in another couple weeks when we have another one of these Facebook Lives, because the insulin, there are a lot of insulins out there, there's a lot of information to talk about with insulin, so we wanted to separate that out as a different topic on a different day. So with that being said, I'd like to shift over to Natalie to talk about a category that we call DPP4 inhibitors. Natalie?
Yeah. So hi everyone, my name is Natalie. As Mr. Stearns mentioned, I did grow up in Ellenville, so class of 2014. I currently go to pharmacy school it's in Rochester, New York. It's called the Wegman School of Pharmacy, which is attached to St. John Fisher College. It's a small school upstate. As you mentioned before, I will be discussing DPP4 inhibitors. It's a pharmacological class that contains 4 different medications. So sitagliptin, its brand name is Januvia, which is the name that most people do know. Saxagliptin, the brand name is Onglyza. Linagliptin is Tradjenta, and last but not least, you have alogliptin Nesina. Alogliptin recently did become generic, so hopefully that does help patients being able to afford this class of medications that are known to be expensive. As Nihat and Victoria mentioned, these medications are primarily used to decrease your blood sugar and your A1C. Some side effects that you can experience while you're taking DPP4 inhibitors are you can experience some diarrhea, some nausea. You can also experience bone pain and muscle pain. As my peers and Mr. Stearns mentioned, it is always important to talk to your provider and your pharmacist if you are experiencing any of these side effects. That way you can all figure out what the best track is moving forward. When you should take this medication, with DPP4 inhibitors, you can take them either the morning or the night. The most important thing is to try to make sure that you're taking your medication consistently throughout the day. So if you're taking DPP4 inhibitors, they're usually dosed only once a day, but it's important to keep the dosing consistent every day. That way it's easier for you to remember. And if you do miss a dose, you can take the dose as soon as you do remember. That way you can ensure that your blood sugar is being decreased and that you are improving the condition of your diabetes. Most people like to know how long they will be taking a medication. With diabetes, it can be progressive, so it's always important to stay in touch with your provider and see how well your diabetes is being well controlled.
Thank you, Natalie. So at this point, one of the things that Natalie mentioned, which is very important, is that diabetes is a progressive disease. At this point in time, we can't really stop it. We can only slow it down. And one of the biggest components of treating diabetes is not medication. It's actually diet and exercise. So we encourage people to speak with a dietitian, speak with their provider about referral to a dietitian, and also potentially physical therapy or somebody that can develop an exercise program for you as well that meets your needs within your capabilities. Not everybody is going to go out and run a marathon. You know, we all have different levels of activity that we can engage in and do well with. I'd like to talk finally today, for at the end of today's program, I'd like to talk about a medication that's been around for a while. It's called Metformin. Metformin is oftentimes the first line of treatment for diabetes after diet and exercise. And it's one of those medications that has many different effects. The overall effect is lowering primarily your A1C by about 1.5%, so it helps with glycemic control. Not fully understood exactly how metformin works, but it does affect the way that the sugar is stored. It affects the sensitivity of the receptors for insulin, so that insulin can pass more easily into the cells, and make an end run a little bit about away from the resistance that we tend to see with type 2 diabetes. Some of the there's a couple different forms of primarily of metformin as an individual item. There's metformin immediate release, and there's the metformin extended release. The immediate release seems to have a little bit more effect negatively on the gastrointestinal tract, and many people get nausea and diarrhea from it. A lot of times what we do is we recommend the extended release form because people seem to have fewer gastrointestinal effects from the extended release form. The immediate release form you would want to take around mealtime. The extended release is usually recommended to be taken with the evening meal. And the doses are somewhat different, and they can be titrated to effect through the measurements that we look at over time. Now, metformin is also available in many different combination products with all of the aforementioned oral anti-diabetic agents. There's various combinations of metformin with these medications as well, and sometimes once your dose of each is determined and seems to be relatively static and working well for you, then we can look at, or the provider will look at, potential combination products for you, because that can often save you an extra copay or save you a little money in the long run in taking these medications. So what are some of the other effects that we can see in addition to the effect we want to see, which is the lower blood sugar? Some interesting things happen with metformin. There's either no effect or a weight loss that occurs often with metformin, and it was looked at research on used as a weight medication, but it's not a weight loss medication, but it's not really recommended for that. But with diabetics, many diabetics are overweight, and so this has helped dramatically because a lot of our insulins and some of the other medication mentioned can cause weight gain. So if we can neutralize weight gain or reduce weight, that's a very positive thing in diabetes. We also, there's a very rare side effect called lactic acidosis, where we can get a buildup of lactic acid in the bloodstream, and that's some of the muscle pain and whatnot that can occur. That's a kind of a rare side effect, and we would see that most likely in older people with some renal or kidney failure involved. Another thing that can happen is a decrease in vitamin B12 levels over a long period of time, so that's easily corrected with vitamin B12 supplementation. Some people can get headaches. There's also oftentimes there's that diarrhea that we talked about, but that's usually very transient and goes away pretty quickly in treatment. So those are some of the things. If you miss a dose and you're close to the next dose, you wouldn't double up. If you remember to take it and there's still a significant amount of time left to the next dose, then it would be okay to take. Most people, once they start taking this medication, are on it for quite some time because it does have many beneficial effects. So I think I'll close with that, and I'll say that we would encourage you to speak with your pharmacist, your providers. This is a complex disease that the more treatment team members involved, and not just the medical team, but also the social team. There's something that rural health has a big role in as well, in meeting with people and helping people with exercise. And I think that Shannon's sitting behind the camera here, but I believe that there's like exercise and yoga and things like that are done also Facebook Live or through other means that can help people with diabetes. And there's a big effort in outreach into our community and further to reduce the effects of the negative effects of diabetes and to lead to having a healthier community. And that's one of the things that we do here at the hospital. We're not just here as a hospital building with people in the building. There's a lot of outreach into the community. There's a lot of things that we do, services that we provide. From the pharmacy point of view, I mentioned before that we do medication reviews. We'll meet with people. We'll talk with you about all your prescribed medications as well as over-the-counter medication, nutraceuticals, what you buy in the over-the-counter as well, because all of these can affect your health and well-being, and that's something that we can work well with. And we often make recommendations to other hospital departments within the hospital to help with overall health care, and we're getting bigger and better and bolder with all the services that we offer here at the hospital and out into the community. So what I would encourage people to do is, if you see this, if you want to give us a call us at 845-647-6400. The pharmacy extension is 227, but you can ask for really any department in the hospital, and we'll be happy to assist you as best we can and provide services to lead to a healthier community. Anybody have anything they'd like to add to, we have a few minutes left here, so one of the things that I would like to say is we do a lot of education at Ellenville Regional Hospital. Obviously we have pharmacy students. I precept for several different colleges of pharmacy at different levels of in their programs. We also have radiology, DO students, PA students, nurses of all different roles, physical therapy aides, and I know I'm leaving some out, but we do have a lot of education going on here at the hospital. In fact, we even have a house that the hospital owns that is available for a small fee for students that come from out of the area to stay. I'm happy to say Niad was our first pharmacy student that used that housing. Most of our other students have been relatively local and haven't had to drive too far, although I think most of them like being here during the summertime and not necessarily in the wintertime, so they don't have to drive over the mountains to get here. Do you guys have any comments that you'd like to make about being at Ellenville Hospital, observations that you've made about working with staff, or we go see a lot of patients and talk to a lot of patients, and I think that's valuable. You've been able to go on rounds, so why don't you just say one or two things that has impacted your stay here?
Okay. I would say what's impacted my stay would be just the personal care that the patients do receive here, and how you mentioned that there are a lot of students from different disciplines, and as healthcare begins to continue to evolve, intercollaboration is extremely important. So I think that being in this type of setting has really helped understand what each one of our roles are for bettering a patient, getting better outcomes, and I think that being at this hospital has put that more in perspective, and you can see how that can flow properly and more efficiently.
Thank you. Victoria?
Yeah, I think that I've definitely seen that Ellenville Hospital is really a team. It's not just one person working on their specific role. Everybody's working together, and we all have the same goal, which is helping the patient as much as possible, and that's definitely been evident, which is great.
Yeah, this is Nihat's last day, by the way. He's been here for 3 weeks with us, and hopefully he'll come back in the future for a longer stint when it gets to that point.
Hopefully so. Yes, this has been an amazing 3 weeks. Again, like Mike mentioned, it's my last day. It's been an amazing experience interacting with the personnel at Ellenville Regional Hospital. Like my peers mentioned as well, it's very friendly. You're able to interact with people from different professions and really collaborate to give the best possible patient outcomes. And just, it's just like really homely and really very close, like what's the word? Close circle and very, is that the word? Close circle? Close knit, tight knit environment where we all know one another, where you can just call each other without having to schedule appointments, and it's very a very warm and welcoming environment, especially for learning purposes. So greatly appreciate the hospitality that Ellenville Regional Hospital has been able to provide. Thank you.
I think we've reached the end of our time for today. I think that this will be an ongoing series over several episodes because diabetes is such an important it's an important disease affecting a lot of people in this country and around the world, and we can do our part to help. So I want to thank my colleagues here at the table and wish them well in their studies, and I'll do my part to help them with their studies, and wish Nihat well in his return to studies, and another shout out to Rural Health for allowing us to do this. Thank you, Shannon.